Hi students. Next clinical scenario, two cases from thyroid gland. You know the diseases hypothyroidism, hyperthyroidism, right? How the clinical scenario will be there, how you have to identify the diagnosis. Usually for hypothyroidism, this is the most repeatedly asking question, hypothyroidism clinical case. Usually females, the major complaints are weight gain and tiredness. The patient is always sluggishness, slow activity, tiredness like that, weight gain. Cold intolerance is the clinching point for your hypothyroidism. Cold intolerance. Next one is heart rate is decreased, that is bradycardia. Skin is always looking like dry skin. So these are all the clinical presentations for hypothyroidism. That is usually females, weight gain, tiredness, cold intolerance, bradycardia, dry skin, and sluggishness. Coming to the hormone level, that is T3, T4, and TSH, you know very well. Hypo means thyroid hormones level will be low, T3, T4 low, whereas TSH is elevated. Right? This is hypothyroidism diagnostic criteria. Whereas coming to hyperthyroidism, the diagnostic criteria is T3, T4 will be high, whereas TSH will be low. Right? Then what are all the clinical manifestations? Here, weight loss. The patient is always having anxiety, looking very irritable mood, tachycardia and palpitation, tremors sometimes. Then heat intolerance. In hypothyroidism, cold intolerance. Whereas in hyperthyroidism, heat intolerance. Sweating will be there. Emotional disturbances will be there. And uh, diagnostic criteria T3, T4 you should mention. That is T3, T4 high, TSH low in hyperthyroidism. So in these two thyroid disorders, that is hypo and hyperthyroidism, you should know about what do you mean by goiter, what do you mean by sick euthyroid, what do you mean by cretinism, what do you mean by primary hypo and hyperthyroidism, what do you mean by primary and secondary hyperthyroidism. Primary means involvement of thyroid gland only. Secondary means involvement of all the three, that is pituitary, hypothalamus, and thyroid gland. So primary hypo, secondary hypo, you should know. Primary hyper and secondary hyper, you should know.